Can stem cells cure your hip AVN? Stem cells have been the latest technology which is revolutionizing medical field for various conditions, starting from heart attack to neurological paralysis. And they have also been tried for the hip AVN patients as a regenerative therapy. As we all know, regenerative therapies are specifically reserved for the hip AVN patients who are in the early stages, stage 1 or stage 2, can avoid a hip replacement surgery but are not responding properly to the medical management. In such patients, earlier we have the options of drilling the holes in the hip joint and sometimes putting a PRP injection into it. But now we are trying one more thing, which is putting the bone marrow aspirate, which has lot of stem cells from the patient's own body into these holes. And a lot of good reports are coming, which are telling us that by putting the patient's own bone marrow aspirate, the stem cells in it can help the recovery of the diseased bone in a more predictable and faster manner than either bone drilling alone or bone drilling combined with PRP injections. So we can say that bone drilling combined with bone marrow aspirates and the stem cells from it is the next era of regenerative therapies in treatment of hip AVN. Success rates have been slightly better than alone bone drilling or bone drilling combined with platelet-rich plasma injection, but again, the unpredictability around the success is still there. It's very difficult to predict which patient is going to respond favorably to this treatment and which will not. But the best part is if you are fall into that special group of patients in whom the early stage hip AVN is not responding to medical management and we want to avoid the progression, we want to avoid this advanced stage of hip AVN, we want to avoid the hip replacement surgery, then this procedure is a very minimally invasive procedure, do not require any big cuts, no major surgery, just simple drilling of the bone and putting the aspirate of your bone marrow through that, and it can actually save quite a number of patients from advanced disease or advanced surgeries. So overall, it can be explored as a very good surgical option for patients who fall into the specific category of such conditions.